Well, I think one of the things that makes it really complex for healthcare organizations is the highly regulated industry of healthcare, right? So I'd love to talk a little bit about that. Um, Marcelo, you guys decided to follow the RNDS, the National Health Data Network model, using HL7 FHIR as the standard. You know, I think it's really important for our US audience to understand that choice. Why was fire so critical?
Yes. In middle of the chaos, have good news. Fire and all of technology, actual technology, it's possible we can resolve these issues. So the second problem is culture and people accept this change.
Mhm.
For use fire, EL7 fire, we need just MR systems, for example. Change information, how they input information. So it's big challenge. But like I said, it's good news for technology. We have Sensedia
Yeah.
help us, and fire is universal language, so tested and proved it works. So uh, it's no any doubt. It's fire is the best way.
Mm-hmm. Mm-hmm.
So more than just a protocol, right? So fire, you do have fire and do have HL7. But when you're going to deep dive in the healthcare ecosystem, you're going to see not just the clinics, the hospitals, and the pharmacies. You need to deep dive with EMR systems that here in Brazil we do have many, in the US we do have many as well. And now we are bearing the same old problem, which is who owns the data and where the data is going to be, exchanged with. So FHIR is the protocol that unifies it. Very good, battle tested, but FHIR is complex, right? And for example, I'm just out of a regular exam with EMR, right, with my physician. They requested deep dive, examinations and more tests. Those test results needs to be in the same standard to exchange information into my protocol to have my data unified. So it's not just EMRs in hospitals. This is going to be extended to equipment retailers, to EMR providers, to pharmacies, to everybody in the chain. So healthcare, in terms of chain, is a very big iceberg of complexity.
Yes.
I love icebergs, as you know. So is a very
Tiny
big
outside,
iceberg. Yeah,
here
it's very tiny and outside. Okay, I'm going to the hospital. I need my data in the hospital. This is, the smaller part. You need every
Yes.
test result, every blood test. If you broke something, if you have a disease, if you have a chronic disease, where is your history? And your history can be, and it is, fragmented. So we bring this up all together, FHIR to help us, and Liberty took this, long journey to first get everybody together, and then get this thing disseminated through not just the institutions that took care of the patient, but the institutions that do the software to take care of the patient. So if you're going to be in a hospital, you have data everywhere. So you draw a blood test, you make a simple consultation on your physician, or I don't know, you stay in an ICU. So you guys imagine how many data you have in an ICU. So everything's fire in HL7.
It's a lot of context.
Yeah.
This biggest difference in open finance and another markets, because in open finance your interoperability is numbers,
Yes.
is most of data. In health, it's context. It's not so simple. The
Yeah.
data.
Well, and one missing data point could mean a person's life, which is really scary, and it underscores the importance.
It's another big problem is in finance. If leak of data, you just drop your credit card,
Yep. And get other.
get an order.
Yeah.
If leak your data.
Yeah. Not much of an option.
Yes.
Well, and from what it sounds like, even though FHIR is complex, it then simplifies the aggregation of that view of the patient so the patient gets that better healthcare and experience.
Traditionally, healthcare integrations involve length analysis, custom mappings, and extensive manual development. In these projects, I believe we combined it with Sensedia API managed platform with AI. Artificial intelligence is here to help us, principle with the large of data and organize this, accelerate a lot. AI helps us to analyze software, structure, subjects, better way for
Yeah.
we can handle of it.
Much more holistic.
Yeah.
Very interesting.